HPV is actually the virus that causes a cervical cancer, and it can stay in the body 20 years.
Yeah.
For some, it can stay for 10 years, it can stay for 15 years without symptoms. So we ask women, don't wait to feel pains, don't wait to experience, anything abnormal, right? We recommend screening. It's only when you go for medical screening that the abnormal cells can be seen.
Through his organization, Itoro has reached over 40,000 women with screening, education, and prevention programs, mobilized more than 200 volunteers, and played a very critical role in influencing the inclusion of HPV vaccination in Nigeria's national immunization policy. His work sits at the intersection of health technology, grassroots mobilization, and policy reform, demonstrating how African-led solutions can deliver measurable impact at scale. Welcome to Just Africa, Mr. Usoro.
Thank you so much, Mr. Manuel, for having me. I'm excited to be on this platform. And of course, to our viewers, good afternoon. Good to be on this platform.
Thank you very much. Now, just like you are excited to come to us, I'm also excited to have you here because this conversation is very, very particular to me. But first off, let's even break into context. What personal experience made you or inspired you to launch the Help the Woman campaign?
Okay, thank you so much for having me on this platform. Once again, I'd like to welcome all our viewers. It's going to actually be very interesting. Yeah, so in 2017, I actually lost my mom to the issue of cervical cancer. And, being so close to her, I haven't seen her sacrifice a lot for myself, my siblings, and the family. I had promised I was going to do a lot for her. So when I was called prior to 2017, that was 2016, and then I was with her in the hospital for about 4 months, and eventually in 2017, January 10th to be precise, we lost her. I was really pained, and this is the reason. When I eventually got to research and understand cervical cancer, what is actually preventable, what is actually treatable if diagnosed early, then why should we lose women to that? And the women in this question now was my beloved mom. So I was really, really, I had made up my mind that I was going to tackle the issue. And from that time, we began reaching out to women, talking to them, getting them to know about it. Because I think when we started, we were talking about remote areas. But Emmanuel, I tell you, right there in Lagos, people do not hear about it. In Abuja, we did Abuja, like city center, we did a campaign that 2 years ago. And then out of 300 and something women that came, just barely 10 had heard about it, and just one screen. So you can imagine the low level of awareness. And my mom was not a village woman per se. She was in short working with the government of the state, and she was someone who was enlightened, but then this also escaped her. So that to me showed that there was a lot to be done in that regard. And beginning from that time, we started planning and putting things together. And we have been on this mission, reaching out to the unreachable, and also every woman we come across to ensure that they are not taken unawares. At least we bring the awareness to them, not just that, also give them the platform to get screened.
Mr. Isoro, let me ask you a very personal question, right? Before your mom died, did you know she had cervical cancer? Was there tests that showed she had cervical cancer?
Okay, so I was so close to her. So, my mom could tell me some personal things. So, the first time she went for the screening, that should be about June 2016. Okay, she came to me and she called me and she was just crying and telling me that she will take of everything she has lived for. So, I asked her problem is she had cervical cancer. Just encourage her and told her nothing will happen to her. Then around August, I was called that she was rushed to the hospital, and just visiting her in that August, we ended up staying till December. I stayed with her all through. So I practically saw the pains, the ordeals, a torment. So I am not just talking about this from the place of research. At least firsthand, I saw my mom go through this, and it was so hurting. It's still hurting, and somehow it has been the fuel and the fire that is firing my
Um,
passion, and we want to kill the monster, and that's
I
why we're here.
I I
Yeah.
understand because Mr. Osoro, I can confidently tell you that we share the same story. Because my mom also, I lost her to cervical cancer a year in 2023. And why I asked you that second question was because all the tests that we did not show until after that 4 months when she died. Just few months before she died, we now found out it was cervical cancer. We were treating something else. That was what the whole test results were showing. That's why I asked you that question. Did she know early? Because what did the hospitals now recommend after they found out that she had cervical cancer?
Okay, so that's why in our work we try to put women through, because HPV is actually the virus that causes a cervical cancer, and it can stay in the body 20 years.
Yeah.
For some, it can stay for 10 years, it can stay for 15 years without symptoms. So we ask women, don't wait to feel pains, don't wait to experience, anything abnormal, right? We recommend screening. It's only when you go for physical screening that the abnormal cells can be seen. And if it is seen early, it is so when my mom saw it in June, by December she was gone, right? Because at that stage she's already advanced, and whatever medical try, they just try to manage. Generally in Africa, women are presented to health facilities at a very late stage, and at that stage, prognosis usually is not good. So we encourage go for screening, and the screening is not a one-off thing.
Yeah.
There are protocols that have been put in place depending on the kind of screening you're doing, whether you should repeat it every 2 years till a certain age. That way you are protected and you are preserved. So it's possible that they checked previously and that they didn't see it. But another thing is, are you sure it was exactly the cervical screening that was done on her? Because some of the symptoms could portray some other
Some
sicknesses,
other
and
things.
then
Yes.
the medical
Yes.
profession
Yes.
for all that. Yeah.
Yes.
So that could have been the issue.
All right,
You're
thank
not
you
wrong.
very much, Mr. Itoro. And once again, welcome to the show. But before you go further talking about experiences, I first of all want you to explain, just as you said, by the time you started, very few women have gotten the understanding of what cervical cancer is. So, for the understanding of the general public, what is cervical cancer?
Okay, so now I'm going to try my best to break this down in the barest minimum. Okay, so already we know cancers. Cancers are, the abnormal growth of cells in different organs. Like in this case, we are talking about the cervix of a woman. That's around the womb. A woman can't really see it, physically. We are looking at it, but then she will need to put her hand through a private part. She'll be able to touch that. That's also where the baby comes out during childbirth. So the cancer is the abnormal growth of cells around that region, and usually because of how that area is, it is not seen. Unlike, let's say, breast cancer, where the woman can feel pains, can feel lump, and all that. In the cervix, you are not going to feel. The woman is not going to feel that at all. Okay, so by the time symptoms start coming, that's already a sign that it is late. It is a sign that it is late. If you are feeling symptoms, at that point, it is already late,
Wow.
right? So that's why we keep encouraging people for screening, because it's only screening that spots this thing right on, time when it is early and when it could be salvaged. So when you
Okay.
go for screening, okay.
Yeah, you were talking about screening. Are you saying that a woman should just walk into the hospital and say, I want to screen for cervical cancer? Or what should make a woman go for the screening?
Okay. Here in Help the Woman campaign, we advocate, for preventive health, not just curative health.
Okay.
So yes, like every year, what we do is we set out timetable and we encourage people go for medical checkup. Now you're not going to for that because you're sick. or you are feeling anything. No, just go and check yourself, see how you are, check your heart, check every other part. Okay. So talking about the screening now, it's the same thing. Now, if it's your first time, fine. When you meet your health professional, your doctor, or whoever is in charge of that, the person screens you. Depending on health of your cervix, the person sees, pathology, or pathology, all that. Whatever they see, they will guide you. They can either tell you repeat the test, or if it was negative and you're good to go, they will give you a time you can come back. Maybe in the next 2 years,
Okay.
repeat this test. Okay, because HPV is actually what causes this. And what is HPV? It is a sexually transmitted infection, right? So,
Okay.
and it is responsible for 80-90% of cervical cancer. And at every point in time, the most of adults, whoever is indulging in sex, will contract HPV. Now, our immune system somehow fights this HPV because the HPV now we have the low risks and we have the high risks. So for the low risk human papilloma virus, our immune system is able to fight it off right after maybe a year or two. But for some persons, they can have what we call genital warts and some other things that goes after a while. But then high risk is what persists and progresses into what we call cervical cancer. And
Yes.
that's your system can't fight. Only way for you to tackle that is to go for the screening. And when you are screened, treatment is administered, accordingly.
So, Mr. Also, the truth is, many people can be scared and overwhelmed with information that they have, right? How early should a woman start screening for HPV?
Okay, so screening is also, preventive, but let's take it, to the basics, which I listened to how I talking about the myth misconceptions here and there as a
Yeah.
result of the vaccine. Okay, so the best way to actually tackle this is, to be vaccinated with the HPV vaccine.
Yeah.
Okay, like in Nigeria currently, that has rolled out for a certain age range, 9
Yes.
to
From 9 years old. Yes.
14. And why? So why is that so? It is assumed that at that age they are not, exposed to sex, and then they've not contracted the human papilloma virus. Because
Yes.
for the vaccine to be potent, there must be no virus in the person's body. So if you are taking the vaccine now and then the vaccine is meeting the virus in your body, the vaccine will not be potent and will not be effective. Okay,
Okay.
so in Nigeria that has been rolled out, that age range. But of course, that is not to say that if you are above that age range, you can't get the vaccine. But the clause there is must not have gotten or contracted HPV. So if HPV is not in your system, then you can still get the vaccination. That's the basic. Then talking about screening, if you are exposed sexually, you are advised, to get screened. Prior to this time, cervical cancer was, they used to call it middle age disease. But I can tell you this from experience. Last year, we saw a 26-year-old lady at stage 4. But we were
Stage
all shocked
four.
because, 26 years,
Wow.
stage 4, not even, yeah.
Yeah.
So, so a lot of things, really change, and that's why we need to really pay attention to our health. We really need to, be up and doing. Don't wait until you break down before you get out there. Like imagine 26 years old,
Yes.
already stage
Stage
4.
four.
That's crazy. Yeah.
Oh, okay, so Mr. Also, there is I don't so I heard this from a nurse, right? Even I doubted it. She says that it is the men that are the carriers of HPV, and they are the ones that are transmitting this thing to women. Please help us clarify that conception.
Okay, so the moment I say sexually transmitted, you should understand the connection. Yeah,
Yes.
the men are actually during the distribution, carrying and all that. But because of the reproductive system of the man is different from that of the
The
woman. That
woman,
of the
yeah.
woman seems to reserve. See, it looks like an incubator, right? So the moment the virus goes in there, it has seen a very comfortable place, except the person, the lady, the woman is able to do something on time. Whereas in the men's reproductive organ, it's rare. But of course, not to rule out that guys do not have. They do. We have what we call the perineal cancer, as a throat cancer. There are some things I wouldn't want to talk here on the video, but there are so many lifestyles we indulge in the name of trying to satisfy their partners that are actually, very risky and poses a lot of dangers, right? Because as a man, you can have it, your own may not be in your reproductive organ. But of course, there are few cases that have been recorded where men had perineal cancer, but it is mostly in women. Okay, let's say out of 1 to 10, the man can have one, but out of 1 to 10 in women, the women can have like 8. So that
Wow.
is why the focus is really
On the
on
women.
women. Yeah, so men have variants and it is
All right.
transmitted sexually.
Yeah, thank you very much. So, apart from the vaccine, are there preventions that, especially the women now, are there preventions that they can take or preventive methods they should be involved in to help them not to contract this infection?
Sure, there are, of course. So I like to start by mentioning some of the risk factors. Take, for example, what happens if you have early contact to sex, you are at risk of cervical cancer. Okay, you are at risk of contracting HPV, which eventually will progress to cervical cancer. And if you have multiple children, like we have people who wants to they want to give birth to a whole football team, that woman is also at risk of having that. And then
Right.
multiple sexual partners also is a risk factor. So we encourage people to ensure that they are faithful. If you can abstain, that's the base until you are ready to commit to a partner. And when we say be faithful, ensure your partner does same, because you can be faithful and your partner is not faithful. So your partner actually bring the package and deliver the package to you. So you ensure that both of you are on the same table of faithfulness and commitment, where you are not indulging in all those multiple sexual relationships. So this is talking about HPV, but then of course several other lifestyles that causes cervical cancer, like in this era of virtual jobs where we can be on phone 24 hours. We are not moving, we're not stretching our body and all that. That contributes as well, and people can have cancers, not just cervical cancer. And beyond that, we talk about smoking. This is also a risk factor. So as much as you can, do well, to abstain from all this. Watch your health. Go for screening. Go for health checks. Exercise. Exercise. Ensure that your blood is circulating, your heart is pumping, and all this will help you lead a healthy life. So yeah, these are some of the
Okay.
things beyond. Yeah.
All right. Thank you very much. Now, when we talk about cervical cancer, most of the 99.9% of the time the attention is on women. How often do you, as someone who is out there advocating for women, ensuring that the knowledge is passed on to women, how often do you also ensure that men have this knowledge of cervical cancer so that they can also take care of themselves for the sake of their partners?
Okay. Thank you so much for that question. I think the first thing that I will already should I say clarify or answer that question is that I am a man. I'm a man. As you can see, I'm a man. So yeah.
Okay.
Yes. So at the very forefront of tackling the issue of cervical cancer, and beyond that, we've put up several structures just to show that the males are part of it. Sometimes when we go for the free, meanwhile we give platforms for free cervical cancer screening. We encourage women to come with their partners. There are some places, some locations we actually visit to give them these services, and then you see the husbands of the wives come out and they are angry. No, you can't do that. My wife cannot, you know. So we use different means. We go as far as even arranging welfare packages, having a town hall meeting, bringing the men, explaining a whole lot, and getting them to become ambassadors of what we are preaching. So yeah, in our little corner, we are trying our best to incorporate everybody, incorporate people on campuses, incorporate the men. On my team, you can see we have the males who are actively involved in what we are doing. And I think we are setting up different structures. We are launching what we call campus advocacy lead, where we are raising leaders in campuses, and it's mixed. So we also bring because most times, you know, little exuberance must have been the foundation of HPV contraction. So we are on a campaign called Catch Them Young. So we catch them young, train them, get them to understand what we're doing, and also become ambassadors, you know, reaching out to other people. And then that's how we're to also get the males to be part of what we're doing.
All right, great. So I have two questions in one. So you take your time to answer them. The first one is, say that a child or a young girl has been vaccinated between the age of 9 and 14. No case of HPV, she's clean. And then she grows up into adulthood, and then the virus comes in. Does that mean she will not be infected? That's on the one hand. And then you were mentioning something when you were explaining earlier. You said when a woman wants to give birth to multiple children, she exposes herself to HPV. Does that mean that even when you are true to one sexual partner, you are still at the verge of getting HPV?
Yeah, but you know, in medicine, you can't really always say 100%, okay, that this is that, this is that, but it's been proven. Why? Because that particular canal, somehow, it's very fragile. And imagine every time you're pushing, it wastes out and could cause, you know, issues in that area, which eventually can give birth to the infections we're talking about. So, and apart from that, you know, previously during our four parents era, you see, the lifestyle was very different. I mean, from the food they were eating, the food we're eating helped their, you know,
Immune system.
help their immune, right?
Yeah.
So their lifestyle, they were trekking long distances, they were doing a whole lot that boosted their immune system. So somehow their immune system was able to combat some of this issue. But you can't say that in our era where even climate has changed. Okay, a whole lot fast food, fast this, fast that, breaking down our immune system, and any small thing it can spark up the issue of cervical cancer or what any other thing. So it's I think medically now, like I was in one international conference by World Health Organization, and that should be last year, and they've even encouraged that even when you were vaccinated, it's not out of place to also try and check out for go for screening. It's not out of place, you know. It's better to be sure than to be caught unawares. So even when vaccinated, just so you know your status and you are good to go, it's not out of place to go for screening. So yeah, to answer that, it's not really out of place, but of course, like we had established, if HPV was not in your body and you were vaccinated, then the possibility is very slim. We can't really say 100%, but very slim for the person to contract it in the future. And I think that's a very good first step in prevention, and that's why we're encouraging everyone to embrace this.
Okay, so I'll take you back a little. You talked about holding town hall meetings and talking to people, husbands and wives and all that, bringing them together and educating them. And at the beginning of the show, you said many people, not even in Abuja and Lagos, have known about cervical cancer. If people in the urban area haven't known much or they've not come in terms with cervical cancer, what do we have to say about people in rural areas? How do we send this message? How often do people take these messages to them and to keep them aware, to make them aware of the danger of cervical cancer?
Okay, so thank you so much for that question. Here at Help the Woman campaign, we do not just come out, because we want to do something. We listen, we monitor, and then we come back to the table to readjust and see how we can give it the best approach, which is why we are launching different things to ensure we are bridging those gaps. So for women in those locations, we have gone there, we've seen, and we are still doing that. Part of what we do, like I said, is to bring them on the table. Sometimes, in the bid to share this information with them, we go beyond the scope of cervical cancer. We go as far as, empowering them, encouraging them in their traits, taking care of their children, doing a lot that at least you open them up to receive the message that we're bringing to them. And beyond that, there are already established structures like the Primary Healthcare Development Agency, which, like in my state, we have over 400 and something plus centers. We liaise and partner with structures. We encourage them, to be operational, because there are some places you go to and you do not see anybody. Okay, this also is a challenge, because if the primary health care is functional and effective, somehow it reduces the burden. Also, will help in the awareness creation. Most times, sometimes you go and this areas, and that also limits awareness. But for us, we use all the channels. We go online. We go to radio. There's another thing about the locals is that they listen too much to radio. So we maximize those platforms. And we do not speak English language when we go on air. Okay, so we communicate in the dialect that they can relate to. And sometimes we do two patients pour in from different centers, because you can see the interest. Why? We were able to speak to them in a language that they understand. We're open, and then we reach out to them with love, and we're able to get them to understand this. We are still on it. It's actually a massive work.
Yes.
We're still pushing. So we're reaching out to more.
Yeah, thank you very much. You'll be able to push through. So let's address some of the myths behind the vaccines. We've heard people say it could prevent a girl child now when she grows up, prevent her from being able to conceive. Some believe that our foreparents didn't take vaccines and they were able to live their lives to 100 and above. So many myths. Can you help clear those stories, those myths that are trendy, that are going around? Some religious leaders preach against it. They tell their church members, don't take it, because those in the Western world want to use it to reduce the African population. What do you have? How will you be able to clear these kind of information that are flying around?
Okay, yeah, that has really been going on, not just for cervical cancer or HPV vaccine. I mean, even the phones we are using. There was when phones came out. I remember people were still talking against it. So people will always talk. That one is basic. But then, what I like to encourage the viewers out there is the federal government will never roll out something that will harm the populace I mean, why would federal government want to do that? Okay, so it has gone through so many clinical, testing, and it is proven to be safe before it is given out. So people should understand that. Now, there is no medication or anything that we take that does not have side effects, right? So that is basic. So, but for HPV, that's right. Before you even take it, before it's being administered to the child or whoever gets it, they're able to take you through and explain some of those things, the likely things you may feel, you know, some of those side effects, which is not really a serious thing. People saying that it's going to stop you from having children. I've maybe I'll have to bring people who actually got vaccinated and they've given birth to children. It does
Okay.
not stop that. The advanced countries were already using this, before now, and that's why we are not having the prevalence and the high rates of cervical cancer in their areas. So this is what we're also bringing now to stop this in our continent, in our country, and it is not harmful. It is not harmful. That somebody has any side effect doesn't mean harmful. It's just like, I mean, people take palm wine and they get intoxicated, right? And after a while they are fine. For some, it's if you're able to know the rationing, because why people actually abuse things is they do not understand the rationing. But sometimes those things they're actually taking helps, but if you exceed a certain limit, it becomes harmful. So it's the same thing for medications and all that. It is not harmful. It cannot stop you from, having a child. It will not make you barren. So I encourage everyone. We've seen
Okay.
people who have it and have given birth to children. So it does not.
Mr.
All right.
Also, Mr. Also, I know our aim is to find ways to eliminate cervical cancer from the African continent, and we're in the age of technology. Are there any of these technology, no matter how small or how large, that you are familiar with that can help us to champion this cause? Because look, the truth is, apart from getting the information to the grassroots or to the young people to start early, are there other technologies that we can use to help us champion this our cause?
Okay, so in our work, what we've discovered is most women come for screening because this is a long chain from awareness to treatment, prevention, and all that is a long chain. There are women that will pass through our welfare package, pass through the educational package, come as far as coming to get screened, but do not come back for their results. That's a challenge. Okay, so for us, really thinking of what do we do. And also get screened up for results. It does make sense because you are as good as you did not hear anything. If you don't go back, get your results, know your status. If there was any issue, it is sorted out. It was good as you didn't even start the journey in the first place. So for us, there's what we are called medic rich. Okay, so we want to actually make this handy. Just like everybody is on TikTok now doing video, doing all that. We're also coming up with a structure in the tech space, so people enjoy. I mean, while you're playing with your videos, you are also taking some healthy precautionary measures
Yeah.
that will help you lead a healthy life. Uh, there's what we call do to earn. We're also integrating that in our platform so that, as you do your earning, and at the end of the day, we're able to actualize a vision of eliminating cervical cancer. So, yeah, these are some of the things we are building. I know of some other, equipment that are being used, but of course, it's still the same thing because you need to hear about it, you need to learn, you need to go screen, and then you're able to get those options. But somehow it's advanced. So I mean, we are building something that will take to every woman, and they're able to access it. Not just access it; it is affordable. They can easily hop on it and then get there. the healthcare that they deserve. So that's what we're working on.
All right, thank you very much. So, as we're rounding off, I want you to give your final word to our viewers and the women, men, boys, girls, everyone watching right now. Your final word on cervical cancer.
Okay, thank you so much. I want to encourage every woman. Nobody should stigmatize any person that okay, it's because of certain lifestyle this can happen. Like in my own case, we are seven in our family. I'm actually the fourth child, and my mom had some complications, especially during the last childbirth, and eventually there was an oversight which event to demise. So nobody should anywhere stigmatize anyone. Instead, let's encourage the women. If you are somewhat connected to a woman, this message is for you. Every woman deserves the best. And what breaks my heart the most is why should a woman die from what we can actually treat? So that's why we call everyone. Please take this message to your mom, take this message to your aunt, to your sister, to your wife, and ensure that remind them, have you gotten your screening? Do you know your cervical status? That way it helps them, to not be taken unawares. A woman can be healthy, very happy. I mean, last year a matron of a hospital met me, and while talking, she said she's feeling some started mention. I just encouraged her to get screened. She got screened, just cervical cancer. After 3 months, she died. I mean, so it can happen to anybody. Imagine a matron of a general hospital. This is happening to her. So what do we talk about the woman inside the village who probably has not even gotten to any healthcare facility? So this is a message for all, and we encourage everyone. It should be a topic we discuss in our family. And for women, please, your menstrual hygiene is also very important. Ensure that you don't go for what is cheap. Most times we go for cheap price and then we go for high cost because what you feel is high price could lower your cost eventually. But then because of trying to go for a cheaper product, you end up, getting things that will harm and hurt you in the future. Ensure that you're using products that are actually good. If you're itching, it's a sign. If you are feeling, discomfort, it's a sign that there's something going on there, and you don't have to ignore that. So I encourage everyone, let's take the message and please do well to support our cause here at Help the Woman campaign. We are looking forward to eliminating this. We are passionate about it, and we need every hand to be on deck. We are doing a whole lot. We are inviting everyone to be part of what we are doing. So,
Thank you so much, Mr. Usoro. Thank you so much for being a part of today's conversation. And of course, we hope to get back to you, so that this advocacy conversation needs to continue because a lot more women need to know the dangers that are out there, especially when they even try to still be noble and pure. Right. But thank you so much for being a part of this conversation, Mr. Usoro.
Thank you so much, Mr. Manuel. I appreciate it.